There is a muscle hidden deep inside your lower leg that may help your body handle sugar after a meal. You cannot easily see it in the mirror, you probably never think about it. But when this muscle contracts, it begins using fuel from your bloodstream. And the movement that activates it can be done while sitting in a chair. No gym, no special clothing, no complicated equipment, just a slow movement of the heel. I am Dr. James Walker, and today I want to show you a simple after-meal habit that may support healthier blood sugar, especially if walking is difficult or you spend much of your day sitting. But I also need to correct one important misunderstanding. A laboratory study found that a carefully controlled form of this movement improved the blood sugar response after a glucose drink by about 52% and reduced the amount of insulin required. But the people in that study performed the movement for long periods under close instruction. That does not mean doing a few heel raises for 10 minutes will automatically lower everyone's blood sugar by 52%. The real lesson is simpler and more useful. Activating your muscles after eating can help them take up glucose instead of leaving all the work to your pancreas. And for most older adults, one of the easiest ways to use that lesson is to move for 10 to 15 minutes after a meal. To understand why, let us begin with what happens when you eat. Carbohydrates from foods such as bread, rice, pasta, potatoes, fruit, cereal, desserts, and sweet drinks are broken down into glucose. Glucose is not poison. Your body needs it. Your brain uses glucose for energy. Your muscles use it. Your organs depend on it. The problem begins when a large amount enters the blood quickly and remains there longer than it should. Your pancreas responds by releasing insulin. Insulin acts like a signal that tells your cells to open their doors and accept glucose from the blood. Some glucose is burned immediately. Some is stored in the muscles and liver for later. But when you eat a large meal and then sit completely still, your muscles need very little fuel. That leaves the pancreas doing most of the work. For a healthy person, this system may handle the meal well. But as we age, lose muscle, gain weight around the waist, or become less active, the cells may stop responding to insulin as strongly as they once did. This is called insulin resistance. The pancreas then has to release more insulin to move the same amount of glucose. At first, blood tests may still look normal because the pancreas is working overtime, but you may notice other clues. You feel sleepy after eating. Your mind becomes foggy. You want something sweet an hour or two later. You feel hungry again even though you recently finished a meal. Weight begins collecting around the belly. These symptoms do not prove that you have diabetes. Poor sleep, large meals, medication, stress, and many other problems can also cause fatigue or hunger. But repeated sugar spikes and long periods of inactivity can place extra pressure on the body's blood sugar system. Now, this is where your muscles become important. A resting muscle does not need much glucose, but when a muscle contracts, its need for energy rises immediately. The muscle can increase its uptake of glucose, including through pathways that do not depend entirely on insulin. In plain language, movement opens another door. Instead of asking your pancreas to handle the entire meal, you give the glucose somewhere useful to go. The thighs can use it, the hips can use it, the back and arms can use it, and one small muscle in the calf can use it too. That muscle is called the soleus. The soleus sits beneath the larger calf muscle. It runs from below the knee toward the heel and helps you stand, walk, and lift your heel. Researchers developed a special seated movement designed to keep this muscle active without quickly tiring it. The movement is sometimes called a soleus push-up. Here is the basic motion. Sit upright in a stable chair. Place both feet flat on the floor. Keep your toes and the front of your feet down. Slowly lift your heels. Pause briefly near the top. Then lower them with control. The toes remain on the floor while the heels move up and down. That sounds almost too easy. But the value is not that one repetition burns a huge amount of sugar. The value comes from repeating a comfortable muscle contraction instead of remaining completely still. Now, this next part is important. The exact laboratory technique was more specific than ordinary heel raises. It was designed to activate the soleus in a particular way and was performed for much longer than a few minutes. So do not treat this movement like a miracle cure. Treat it as one practical way to break up sitting and keep a muscle working after meals. Begin gently. Try the movement for 1 or 2 minutes, rest if needed, then repeat it several times during the first 15 to 30 minutes after eating. You can do it while watching television, reading, using a computer, or speaking on the phone. The movement should feel smooth. You may feel the lower calf working, but you should not feel sharp pain in the knee, ankle, calf, or Achilles tendon. Stop if you develop pain, severe cramping, dizziness, or unusual shortness of breath. And if you have a recent leg injury, severe circulation disease, a history of blood clots, foot wounds, or instructions to limit activity, ask your doctor or physical therapist what is safe for you. Now, seated heel movement is useful. But when you can walk safely, walking after a meal may be even more practical because it activates far more muscle. Your calves work, your thighs work, your hips and core work, your heart pumps a little faster, and all of those tissues begin using energy. Research in older adults at risk for poor glucose control found that short walks after meals improved blood sugar management. The benefit did not require a hard workout or a long gym session. A gentle walk can be enough to make a difference. Try walking for 10 to 15 minutes after lunch or dinner. The pace does not need to be fast. You should be able to speak in complete sentences. You can walk outside. You can walk through the house. You can walk along a hallway. You can take slow laps around the kitchen and living room. The route does not matter. The goal is to replace sitting with safe movement while glucose is entering the bloodstream. Now, look at the timing. Many people exercise in the morning and then sit for the rest of the day. Morning exercise is valuable, but it does not completely erase the effect of sitting after every meal. Think of each meal as a separate event. Breakfast creates one rise in glucose. Lunch creates another. Dinner creates another. A few minutes of movement after each meal gives your muscles 3 opportunities to help. You do not need to become exhausted. Consistency matters more than intensity. This is especially important after 60 because muscle mass naturally declines when we do not challenge it. Less muscle means less tissue available to store and use glucose. That leaves more pressure on the pancreas. It also means weaker legs, poorer balance, and greater difficulty staying independent. So an after-meal movement habit supports more than blood sugar. It helps keep the legs active. It interrupts long sitting periods. It supports circulation, and it reminds the muscles that they are still needed. Now, what if you cannot walk for 10 minutes? Use the chair. Perform slow heel raises. March 1 foot at a time while seated. Straighten one knee, lower it, and then switch sides. Reach the arms forward and bring them back. Stand up and sit down from a sturdy chair a few times if you can do so safely. Hold a counter and perform gentle side steps. Even washing dishes or cleaning the kitchen after dinner keeps more muscle active than sitting on the couch. The best movement is the one you can perform safely and repeat consistently. Now, I want to address the after-meal crash. Many people eat lunch and feel tired soon afterward. They assume it is simply age. Sometimes the meal is too large. Sometimes it contains a heavy load of refined carbohydrates. Sometimes poor sleep is involved. And sometimes changes in glucose and insulin contribute to that tired, foggy feeling. A short walk may help by increasing circulation, using some of the incoming glucose, and preventing you from falling into a long period of complete inactivity. But do not use symptoms alone to diagnose yourself. You can have high blood sugar without feeling anything, and you can feel tired after meals while having normal blood sugar. The only way to know is through proper testing. Ask your doctor whether you need a fasting glucose test or an A1C test. The A1C gives an estimate of your average blood sugar over the previous few months. Some people may also be asked to check glucose at home, but that decision depends on their diagnosis and treatment. Now, this warning is especially important for people already taking insulin or medicines that can cause low blood sugar. Activity may lower glucose. That is usually helpful. But when combined with certain medications, it may sometimes lower glucose too far. Signs of low blood sugar can include shaking, sweating, sudden hunger, confusion, weakness, dizziness, or a fast heartbeat. If you use insulin or diabetes medicine, ask your clinician how activity after meals may affect your glucose and whether you need to check it. Do not reduce medication because you started walking. Do not take extra medication because one reading is high. And do not replace medical treatment with calf movements. This habit is a support, not a cure. Now let us make the plan easy. After your next meal, do not immediately sink into the couch. Wait only long enough to feel comfortable. Then choose one movement. Take a gentle 10-minute walk. Wash the dishes and clean the kitchen. Perform seated heel raises while watching television. Or combine them. Walk for 5 minutes, then perform heel raises while sitting. If 10 minutes feels difficult, begin with 3. After a few days, increase to 5. Then slowly work toward 10 or 15 minutes. Your body responds to what you repeat. One perfect day will not transform your metabolism, but a small action after most meals can become a powerful routine. You can make it easier by attaching movement to something you already do. After breakfast, walk while making a phone call. After lunch, take a lap around the building or house. After dinner, clean the kitchen before sitting down. When watching television, lift your heels during every commercial break. The less you depend on motivation, the more likely the habit will last. Now, let us talk briefly about food. Movement helps, but it does not make every meal harmless. A large, sweet drink, a plate filled with refined starch, and a sugary dessert can still create a heavy glucose load. Build meals around protein, vegetables, and fiber. Add reasonable portions of carbohydrates rather than making them the entire meal. Choose beans, oats, whole grains, fruit, and other higher fiber foods more often. Eat more slowly, and stop before you feel uncomfortably full. You do not need to remove every carbohydrate. You need to give your body an amount it can handle, then let movement help. Now, here is what I want you to remember. The soleus is a small muscle with an interesting ability to remain active for long periods. A controlled study showed that a specialized soleus movement could significantly improve the body's glucose and insulin response under laboratory conditions. But the larger message is not that one calf exercise replaces walking, healthy food, weight management, or medication. The larger message is that sitting still after every meal wastes an important opportunity. Your muscles are one of the body's greatest tools for handling glucose. Use them when glucose is rising. Walk if you can, move in the chair if you cannot, clean the kitchen, climb a few stairs if they are safe for you, lift your heels, move your legs. Do something gentle for 10 to 15 minutes instead of remaining completely still. Before you finish your next meal, decide what your movement will be. Do not leave the choice until later, because later often becomes the couch. Your plan can be as simple as this: meal finished, water taken, 10 minutes of movement, then continue your day. I am Dr. James Walker. Use your muscles, protect your blood sugar, and remember this: the movement does not have to be difficult to matter. It only has to be safe, timely, and repeated.